As I'm going to speak about age-related decline of male fertility, and this is the other side of the coin. And I'm going to address 5 issues. Does the male biologic clock exist? At what age are men most fertile? And at what age do men stop producing sperm? And how age can affect male fertility? And what about male age and assisted conception technique? This is the oldest man that has got a child at 96 years old. And 25 years before, when he was 65, he has got his first child. So this would give you the impression that fathering children can happen at any age and is eternal. But this is a misconception, because also men will experience the effects of aging with a decrease in fertility over time. And men, just like women, do face a biological clock. And this was early noticed in 1995 by Penrose, L. and Camp. We haven't yet pointed exactly what age men are most fertile. We know that male fertility should decline at the age of 35 and gets deeper at the age of 40. And the Center of Disease Control consider that after the age of fertility, at 40, there is a major decline. And one study evaluated the relationship between age and semen parameters and concluded that fertility decline at 35 and suggests that the male fertility peaks is about 30 to 35 years old. But when men will stop producing sperm, actually men will never stop producing sperm, but there is a measurable decline, as you can see from the chart, a decline that will happen through the years, not steeper like in female, but gradual decline in count, in motility and morphology after the age of 35, as the WHO last stated. How male is affected, what mechanisms affect spermatogenesis? Mitochondrial damage will induce reactive oxygen species. Aging will impair spermatogenesis through hormonal imbalance, and immune system disruption cause inflammation and fibrosis and impair spermatogenesis. How it will affect fertility? Number one, pregnancy rate will be lowered. We can see generally a 50% reduction in fertility rate when men are in their mid to late 50 compared to 30s. A 5-fold increase in time to pregnancy that will occur in men aged over 45 relative to men less than 25. Thirdly, there is a miscarriage risk. Yes, this is very important because pregnancy loss between the 6 and 20 weeks of gestation period increase in further 35 years or older. And we have a high risk zone when paternal age is over 40 and wife are 30 to 44. And the highest risk zone is when the male is over 40 and the wife are above 35 years of age. This is 6 times more incidence in abortion than young group. Also, it was noted that there is adverse pregnancy outcomes that can occur when a male that have 45 years or above, like the risk of low birth weight, stillbirth, and preterm birth. There was also a weak association between the occurrence of preeclampsia and paternal age. There is also offspring health risk. Although the probability is generally low, but it exists. Older father can have children with schizophrenia, bipolar disorder, autism, Down syndrome, and childhood leukemia. The reason is that sperm random mutation can increase over the years. So sperm quality will change by year. there will be a decreasing count. Although this is not stated by all studies, but many of studies are claiming decrease to 2.6% per year. Sperm motility, a decline of 0.8% per year of age, and the normal morphology decreased by about 0.65% per year, and DNA fragmentation is increasing by 0.3% per year, and meiosis quality is impaired also, giving rise to the de novo point mutation. Actually, a man that has 50 years has a 840 rounds replication compared to younger age, and this will give rise to many mutations that can impact on the fertility of and the offspring. What about assisted conception? Actually, few studies have investigated the effect, and the results are conflicting. Some studies say it's not associated with pregnancy outcome using IVF, while others report a decrease in birth rates. This is a very important meta-analysis done on a large number of patients in 2020, a total of 32,484 cycles. And it showed that a statistically significant positive effect of paternal age less than 40 years was noted in clinical pregnancy, live birth, and miscarriage rate, while in paternal age less than 50 years old, also a significant reduction in miscarriage rate and increased blastocyst rate and number of leach-stage embryo in donor oocyte cycles where maternal age was controlled. This is another important paper done on donor oocytes, and it showed it does affect fertilization rate with statistically significant, but it didn't show any affection on cleavage or pregnancy rate or IVF outcome. This is a very interesting study done in France, taking into account that the interaction between male and female age is very important, as older males are mostly married to older females. So the odds ratio to failure to conceive for paternal age 40 or more was more significant when female were older than 35 years as compared when the same female age to younger female age. So the same result was not applicable or noticed in younger wife, whatever the male age was. This is from we studied in Adam International Hospital. We found in the patients who have more than 40 years age, an increase in aneuploidy rates when doing FISH for family balancing, but we didn't reach statistically significant results. So lastly, how can we treat this condition? Antioxidant is proposed as a therapy for such condition, but I cannot advise you which dose, which drug, which combination. This is still under research. There is only 3 publications about this item in aging men with conflicting results. Should we do cryopreservation before the age of 35 years old? Probably the answer is yes, but it's not very practical, and people cannot think that they will need at older age to use their sperm. I think that advising couple to conceive at young age can be the solution. And if the male has to marry again, he has a better chance with a younger wife than an older wife. So my final message will be, as we have seen together, that men do have a biological clock, and sperm changes occur, yes, with advanced male, and those changes may affect natural pregnancy and ART outcome. Thank you.